Hi everybody, welcome to Dr. Manny's YouTube Learnshops. This is a section on qualitative research. This presentation will look at sampling in qualitative research, and this is part 1. The learning objectives for this session are to review certain methods of qualitative sampling, and we'll be focusing on non-probability sampling. And some of the components will include purposive sampling, convenience sampling, snowball sampling, and quota sampling. And we'll also discuss sample sizes in relation to qualitative research. Now, qualitative research, the primary objective is to understand the subjective reality of the study participants, recipients, subjects, whatever terminology that you'd like to include. And this won't be achieved through superficial knowledge about large representative samples of individuals as is done in quantitative research. Rather, we as qualitative researchers want to reach people within the study area who can share their unique perspectives, their beliefs about what they feel reality is. And it's in this way that all the slices can be put together to illustrate the range of variation within the study area that you're undertaking. In qualitative research, the rationale is essentially to describe the perceptions, the experiences of the participant. And then as you, as the analyst, as the researcher, to understand what they're saying to you, and then you explain. It's also to identify certain issues and develop and possibly generate a theory or a hypothesis. So when it comes to sampling, sampling essentially is the process of selecting a number of participants, subjects, recipients that are going to be involved in the study. Now, sampling in qualitative research, this is where qualitative researchers select who they want to study. And they select the participants according to their characteristics that they know and the knowledge that they think they have. And the general rule in qualitative research is that you continue to sample until you're not getting any new information or you're no longer gaining new insights into the data that you're collecting. This is called saturation. This is called data saturation. This is called theoretical saturation. But essentially, in qualitative research, you continue to sample until you're not getting any more information that is new. If you're getting new information, you continue to sample. Now, types of sampling methods that can be used are nonprobability, which is non-random, and this is typically in qualitative research. And this can include techniques such as snowball sampling, convenience sampling, judgmental sampling, or quota sampling, which we'll review. Then you've got probability sampling, which is typically quantitative and it's random. And this can include things as random sampling, systematic sampling, stratified sampling, or cluster sampling. But there are many, many, many more. Depends on what you want to find out. Examples here, we're going to be looking at non-probability sampling, and as I mentioned previously here, convenience sampling, quota sampling. Other aspects could include dimensional sampling. There are many, many different types of non-probability sampling. Okay, let's review purposive sampling. Purposive sampling, this is the most commonly used method for data collection in qualitative studies. And this is where the researcher, you, attempts to obtain a sample that appears to be representative of the population. It's a process where the researcher selects a specific sample or a setting based on the research question. You decide who you're going to sample. You decide where you're going to sample. And the researcher then employs their experience and their knowledge about the research topic or the group that they want to investigate or research to select the most productive sample to give them the data that they need. So purposive sampling basically means you have a purpose in what you want to achieve. You know what you want to achieve, you know how you're going to achieve it, and that's how you'll determine your sample. Types of purposive sampling then can include, and this is not exhaustive, this is just some. As master's students, it's up to you to do further investigation, further research, further data collection to supplement your knowledge base. So the first one is convenience sampling. And convenience sampling, from my perspective, is just ease of access. It makes it easy. So convenience sampling can be defined as a group of individuals who are believed to be representative of the population from which it's been selected, but chosen because it's close to you. It's close at hand. It's easy, it's convenient, rather than being randomly selected. The selection of the sample then is, it's convenient for you. And therefore, quantitative researchers might consider that being biased. So for example, when you simply ask any patient in your clinic who is willing to participate in the study, or you've got colleagues that you want information from that you know, it's convenient. So you ask them if they're willing to participate in the sample. That's convenience sampling. Now, what are some of the characteristics of convenience sampling? Well, it saves time, it saves money, it saves your effort. However, some researchers believe it's the poorest as far as rationale goes, and it has the lowest credibility. And it often yields or provides information that isn't so good. They consider it to be less rigorous as far as a methodology goes, because it involves a selection of the most accessible subjects and possibly can't be generalized to other populations. It's the least costly to you as the researcher in terms of time, effort and money, but as I said, it's considered to result poor quality data and lacks what some researchers consider intellectual credibility. But there's the element of convenience in many, many qualitative studies which do yield good information, good data, trustworthy data. Then you have what's called criterion or criteria sampling. And this is where all participants, subjects or cases meet a certain set of criteria, and that's why they're selected. In criterion sampling, it's important to select the criteria carefully so that as to define the cases that are going to give you the information that you want and the rich data relevant to a particular research problem that you want to investigate as a researcher. So for example, me as an ICU nurse, all former patients in an ICU who return to the intensive care with the same complaint within 3 weeks may constitute a sample for a further in-depth qualitative study. Why? Why are they coming back 3 weeks after they've been discharged from ICU? These criteria would facilitate a study of the effectiveness of aftercare programs that are associated with intensive care units. Another example of sampling could be volunteer sampling. And these are samples that are often drawn through advertising, requesting people to volunteer to participate in a study. This can be very, very useful when potential participants are scattered throughout the community or difficult to contact directly. However, volunteer samples are typically biased in particular ways. For example, a volunteer sample of people living with AIDS will systematically be biased to exclude people who are denying, or they don't want to share the fact that they have HIV, or they ignore their HIV status. So volunteer sampling may have certain biases associated with it, which will not provide trustworthy, credible information about a particular problem. Then you've got opportunistic sampling. And opportunistic sampling, this is where new opportunities arise to recruit participants or to gain access to a new site which may develop after the fieldwork has begun. It provides you with opportunities that weren't there in the beginning, but as you start to gather your data, you see, oh, this could be here, something that I could utilize. So for example, a researcher who's studying heart attacks, heart disease, acute coronary syndromes, and they may meet a cardiologist while interviewing one of his patients. And the cardiologist then says to you, well, gee, I mean, I could suggest to you, as the researcher, to contact some of my colleagues, other cardiologists, who would be willing to refer their clients for you to interview so that you can gather more data. So the cardiologist is offering you, as the researcher, an opportunity to get more data from other cardiologists. Opportunistic sampling. Then you've got homogeneous sampling. And with homogeneous sampling, the sample is selected because the participants or the sites where you want to gather data possess similar characteristics. And this focuses on reducing variation, which simplifies your analysis, and it facilitates group interviewing because they have similar views. And this strategy requires you as the researcher to identify characteristics and locate the individuals or the sites that possibly possess them. You're looking for similar characteristics in your sample. Some people may see that as bias. Not in qualitative research, it's not. Then you've got a technique of sampling called snowball sampling. And this is when the researcher has got limited data about the study, and he asks participants in the study if they can recommend other people who could be sampling. In other methodologies, such as grounded theory, this is referred to as theoretical sampling, because you're going onward to look for other participants that could give you more information about what you want to find out. However, you're initially contacting a few potential participants, and then you ask them whether they know anybody with the same characteristics that you're looking for in your research. An example, for example, if you wanted to interview a sample of vegetarians, cyclists, people with a similar disability or a similar knowledge base. Then we have quota sampling. And quota sampling is the process where you as the researcher collect data from participants in the study who've got similar identified characteristics. And these characteristics might include their age. So you may be wanting to investigate something related to the elderly or geriatrics. You may look at their place of residence. Are they urban or are they rural or are they semi-rural? You may look at gender. Males, females, males comparing females. You may look at their class, upper, middle, lower. You may look at their professional status, their marital status, whether they use a particular type of contraceptive or their HIV status, etc., etc. There's lots and lots of things that relate to quota sampling. But generally, quota sampling is used in methods research. And the steps basically are to identify specific subgroups and take each group until the desired number of individuals are met for your research. Then you've got case sampling, and there are 3 types. Typical case sampling highlights what is typical or normal or average. And this is where the case specifically selected because it's not in any way atypical. It's not extreme, it's not deviant, it's not intense, it's not unusual. And this is a strategy that's particularly useful if the research report will predominantly be read by people who are not familiar with the area being researched. So for example, in studies of villages in Malaysia or in developing countries, typically selecting a typical village allows the research and researcher to demonstrate or illustrate the general process that occurs depending on what they're wanting to research. Then you've got critical case sampling. And this permits logical generalization and maximal application of information to other cases. Because if it's true, in one situation, it will probably relate to other situations, so it can be generalized. And typically this is done to test a hypothesis. And typically it's done in quantitative research, but it can be done in qualitative research or as a mixed method. And this tests a hypothesis by choosing a case that permits logical deductions of the type. So for example, if this is a valid in this case, then it should apply to all other cases. So for example, you may be doing research in relation to alcohol or drug abuse in one area or one case, then it may apply to other villages or areas that are similar. Or, having said that, if it's not valid for this case, then it could be unlikely to be valid for other cases. Then you have the extreme or deviant case sampling. And this is learning from highly unusual manifestations of the phenomena that you're interested in researching. And this obtains information on unusual cases, which can be especially problematic or bad, or they can be especially good. You've identified, gee, this is a really bad case, or this is a really good case. And examples could be an outstanding success and notable failures, top of the class, dropouts, exotic events, or crises. So why are some students so successful compared to other students that are not successful? Why are some students in this category at the top of the class and others at the bottom of the class? Extreme or deviant case sampling. Then you've got, as I mentioned previously, theoretical sampling. And theoretical sampling typically is used in grounded theory. And this is the process where data collection for generating a theory, which is you, the analyst, collects, codes, analyzes his or her data, and decides what to collect next and where to find them in order to develop the theory as it emerges. This is a quote from Glasser and Strauss, who are both grounded theorists. They developed the research methodology of grounded theory. And it's this sampling process that's entirely controlled by the emerging theory, which basically means if the researcher thinks they're not getting enough information or data or new information, they can go to other sources to collect that data, which in other research methodologies such as quantitative is seen as bias. So here's a question for you to consider in relation to sample size. What is an appropriate sample size for qualitative research then? Is big better? Is small unacceptable? Do you need a formula to calculate the sample size? Well, essentially, the best answer is the sample size is the one that adequately answers your research question. This can be answered by one person, or it can be answered by many persons. It depends on what your research question is and what you want to determine. However, in qualitative research, qualitative sample sizes are typically smaller than their quantitative counterparts. However, they should be large enough to obtain sufficient data to describe the phenomenon of interest that you want to research. And in then doing so, this addresses the research questions. So the goal of qualitative researchers should be the attainment of data saturation. And data saturation occurs, as we mentioned previously, when adding more participants to the study doesn't provide any additional or new information in relation to the topic that you are investigating. And when you get data saturation, the research data collection can stop. So when we look at sample sizes, what are some of the decisions that you need to make regarding sample size? Because they differ. And sample sizes are basically based on needs related to the study purpose. The number of subjects, participants, recipients is typically smaller. For example, in case studies, you may only have one subject that you want to use. However, some of the experts in research, the theorists, the academics, they believe that 5 to 15 subjects is not unusual. What are some of the factors that influence sample size? Well, it depends on whether it's a quantitative or a qualitative research approach. What's the purpose of the study? What's the population that you've got to choose from? So for example, if you wanted to do research about a specific population and there's only 10 of them, well, you can't look for 100. If you've only got 10, you've only got 10. And some of them may not be willing to participate. Some of the other factors that influence sample size is risking the selection of a bad sample. Meaning that maybe the participants aren't really wanting to participate in the sample. And in doing so, you may not get the information that you want. And that would add to bias. Other things that can affect it could be sampling error allowance. Certainly here, in the COVID-19 situation or online where you're doing gathering information, not face-to-face, this could provide wrong data. So there's a difference. So there are numerous factors that could affect your sample size. As I indicated earlier, some of the suggested sample sizes are typically greater than 15 and could be less than 50. That's according to some of the academics. That if you do your further reading, you will see that. However, from my perspective, and from most qualitative researchers, what you want to do is achieve data saturation or theoretical data saturation where you're getting no new information. about the topic of interest. Quality over quantity. The first objective for you as a qualitative researcher is to ensure that you've got the appropriate sample being recruited for your study. There's no point recruiting adolescents if you're doing research about geriatrics. I mean, if you're doing research about disabilities, there's no point recruiting healthy people. So the sample for the study are those participants, subjects, recipients, who meet the inclusion criteria. And it's only those participants that match your inclusion specifications that should be recruited. I mean, if you're doing research about nurses who work in gerontology, there's no point recruiting participants who work in pediatrics. Doesn't make any sense. So the inclusion criteria is important. Next, it's appropriate to choose the right study design. And the type of qualitative study is an important factor when choosing the sample size. So you've got to have an idea about what design or research approach you want to use. And there are various methods that can be used to gather good data, but not all methods may be applicable to your study and its objective. So before choosing a sample size, make sure that you're really clear about your research design, your approach, your methodology, and this will involve your parameters, your aims, and the controls which are clearly outlined by you as the researcher. I'm going to go back to the principle of saturation because this is important. Now, the principle of saturation basically states that a sample size should be large enough to sufficiently describe the phenomenon of interest and address the research question, your research question. The goal of qualitative research is to achieve data saturation. And I'm going to re-point this out again, that saturation occurs when adding more participants, your sample, to the study doesn't provide you with any new information, any new perspectives. So, in summary, when it comes to sampling, it's really about your design. I look at the character here now. Who wants to participate in this study? I guess this could be considered volunteer. This is not my opinion. It's an exhaustive exit poll result with a sample size of 1. So it's his opinion only. Sample size may not be large enough. For a fair selection, everybody has to take the same exam. Please climb that tree. Incorrect. So you haven't got uniformity. None of the animals, for example, there can climb a tree except for the monkey. So unfair selection. Anyway, in conclusion, sampling is one of the most important aspects of a research design. Sampling refers to the process of selecting a subset of items or things from a defined population for inclusion into the study. And it's that subset of items or things that you include in your study. They may not always be people. It may not be what you want to research. People are certainly the most common sampling unit in social and behavioural research because it's about human beings, and certainly in nursing. Nursing is about people, not about numbers. But sampling units can also be groups, events, places, and points in or periods of time. So whatever sampling approach that you as the researcher, you need to consider carefully how you're going to select those items. And that comes into your inclusion criteria. Okay, thanks everybody. As previously, if you found this session worthwhile, check out some of the other Dr. Manny Learnshops on YouTube. Okay, bye for now.